Thailand is remarkably interesting because it may be that we've all got a lot to learn from it, but I'm not quite sure what the message is yet. Now, the cases and the numbers are relatively low, and yet we were reporting on this Thai taxi driver who caught the virus from a Chinese tourist. Oh, way back. It's one of the earliest things I reported on. So spread to Thailand was very early. So why isn't it spread greatly in Thailand? Well, it's a good question. Now, I've been talking to an Scottish doctor who's actually in Thailand at the moment. And these are his observations. So people spend much of their time outdoors, are a fairly light skin colour, and therefore probably not deficient in vitamin D. So that was this British doctor's thinking. Also, he said wearing face masks is almost universal. Now, I used to work in Thailand a long time ago with the Cambodian refugees, and wearing face masks is just part of the culture. People very often wear face masks. Same in many places in Southeast Asia. It's a common part of the culture. In Cambodia, it is very common. Whereas in the UK, I think part of the problem that we haven't been wearing face masks when we should have been is this cultural barrier to it. People in the UK find it difficult to wear face masks, but in Thailand, it's just normal. You know, Japan as well. You got a cold, you wear a face mask, normal. So I think that's probably been quite a big factor in preventing people that have the disease spreading it to other people as well. So the vitamin D in the face masks. Now, everyone has their temperature taken. This doctor says, okay, not the best screening, but easy to do, which is true. You just use one of those electronic thermometers before being allowed into a shop or a mall. Now, of course, you could fiddle this by taking paracetamol, acetaminophen, Tylenol, ibuprofen. But it's better than nothing. People getting the temperature tested. Doorman meets you at the entrance of a shop, supermarket to squirt alcohol onto your hands. Now, this is excellent. Now, in the UK, the alcohol's available, but in Thailand, someone's there saying, "Oi, take this, mate. You're having this hand sanitizer." Because I believe hand sanitisation is very important in public places. Shopping baskets are cleaned after each use. So you see, these are very simple strategies. You know, are these the simple things that are making the difference and have prevented great spread in Thailand? And this is a doctor on the scene thinking about this, and so you know, we have to listen to this. In Phuket, at least, there is little public transport. Most people travel around on mopeds and cars. Now, like every time I've done a few teaching trips to Cambodia, and the first thing I do is go hire a little Honda 125 or something for $5 a day, because everyone gets around on little motorbikes. It's absolutely universal. Or push bikes. So little use of public transport. And of course, push bikes and motorbikes are in the fresh air. They're not in cars sharing with other people. They're not in buses and trains sharing with other people. They're either cycling or on their little moped or small motorcycle. Interesting. The authorities isolate known hotspots. So there's been good isolation of known hotspots. And they test everyone there. So targeted testing. As in South Korea, targeted testing. Then you can have targeted tracing. Then you can have targeted isolation and quarantine. Now, this guy's just in Phuket, but we assume that's happening in other places as well, so also good. Each case is given a number and information is published, so it's made public as to which positive cases are and presumed to have contacted people that are presumed to have contact with that person. So this is kind of put into the public domain so you can look up people and see if you are at risk. Now, I know people are throwing their hands up in horror all over the place, but it does appear that Thailand has got low numbers of cases and low numbers of spread. A chain of infection can then be worked out. Interesting. A recent spike of 18 cases yesterday was due to a group of migrant workers. I only got this email yesterday, so that must have been the day before. who were in quarantine. So migrant workers were quarantined when they arrived. So hopefully that is completely contained because of the quarantine strategy. Now I got this, so that's what that doctor said. So all very interesting and all well worth serious consideration for everywhere. This is why it's so important to compare places internationally, because we can work out what some people are doing right. And very often the best interventions are not expensive, they're not high tech, they're dirt cheap, just a matter of instigating them. Like having someone at the entrance to the shop squirting hands with alcohol hand cleanser when you go in. And this is a different email I've got, but also from Thailand. When the outbreak occurred, they switched off the aircon in the school my daughter teaches at. Remember the Diamond Princess? We were suspecting the aircon. We know that virus can be aerosolized and spread around in the air. It's an airborne virus. So they switched off the aircon. Dead easy. Opened all the windows. What we've been saying for months. Open all the windows, dilute the virus, and wear masks. So turn off air circulating systems everywhere around the world, open all the windows, and wear masks. It's not expensive. Why isn't everyone doing this? I don't know. Open the windows. What's difficult? All public spaces need to be well ventilated. People need to be clean. People need to be wearing masks. Stop the spread in shops. Stop the spread in public transport, or massively reduce it. So Thailand there, not a rich country, instigating simple measures, targeting its testing, greatly reducing the transmission. That deserves respect and consideration.